You've memorized lab values, you've drilled hundreds of practice questions, you've reviewed the NCLEX test plan until it feels etched into your brain, and yet the thought of exam day still makes your stomach drop. Why? Because success on the NCLEX isn't only about what you know, it's also about how you think. One powerful mindset shift can take you from anxious, second-guessing test taker to confident, focused nurse in the making. And the best part, it's not about adding more hours to your study schedule. It's about changing how you approach every question. Welcome to Nurse Career Blueprint channel. I am Nurse Miriam. The old mindset, I need to get every question right. Many nursing students enter NCLEX prep with an all-or-nothing mindset. If I don't know everything, I'm doomed. Here's the truth. The NCLEX doesn't require perfection. It requires competence. The test is designed to assess your ability to think and act like a safe entry-level nurse. That's it. You can miss some questions and still pass. The problem with the I must get everything right mindset is that it increases anxiety with every tricky question, causes you to rush to make up for a wrong answer, distracts you from applying critical thinking in the moment. The new mindset, one question at a time. The single most powerful shift you can make is this. Stop thinking about your score. Start thinking about the patient in front of you. Each NCLEX question is a new patient scenario. Your job isn't to be perfect, it's to give the safest, most effective care for that one patient right now. When you reframe the exam as a series of patient encounters instead of a points-based test, you reduce pressure, stay present, and make better clinical decisions. This mindset also mirrors real nursing, where you handle one patient at a time even if your shift has 10 charts waiting. Why this mindset works? It reduces test anxiety. When you focus on the big picture of passing, your brain can spiral into worry about past or future questions. A one question at a time focus keeps your attention in the present where it belongs. It aligns with how the NCLEX is scored. The NCLEX is computer adaptive. It adjusts difficulty based on your last response. The only question that matters is the one in front of you. It mirrors real nursing judgment. As a nurse, you won't have a scorecard in front of you. You'll have patience. Treat each NCLEX question like you're standing in front of that patient. Please subscribe for more NCLEX strategies. How to adopt this mindset in your prep 1. Practice like it's the real thing. When doing practice questions, pretend you're in the exam. No phone, no notes, no looking up answers. Before answering, take a mental pause and think, if this were my patient, what would I do first? 1. Use a question framework. Frameworks help you keep your thinking structured when nerves kick in. Try ABCs, airway, breathing, circulation, Maslow's hierarchy, physiological needs before safety, before psychosocial. Safety. First, protect the patient from harm before anything else. Example, if a patient is anxious but also has low O2 saturation, airway breathing comes before comfort. 1. Stop exam score math. Don't count how many hard questions you've seen. Don't try to predict if you're passing mid-test. It's impossible and drains focus. Commit to answering the next question to the best of your ability, then move on. Please comment below and also share this video to help others. 1. Reframe mistakes as data. When you miss a practice question, instead of thinking, I'm failing, say, this is showing me what to improve before test day. A mistake in practice is a win. It's one less mistake you'll make on the real exam. 1. Visualize exam day. Success. Athletes do this before big games, and it works for test takers too. Picture yourself walking into the testing center, calm and ready. Imagine reading the first question, taking a breath, and answering with confidence. See yourself leaving the test knowing you gave each patient your best judgment. Your brain doesn't fully distinguish between vividly imagined experiences and real ones. So visualizing confidence helps create it. A sample, one question at a time in action scenario. A patient with pneumonia is admitted with O2, sat 86%, fever, and a productive cough. Old mindset, reaction, panic about remembering every pneumonia intervention, stress about what you scored on the last question, and a rush to answer. New mindset, reaction, this patient's oxygen is low. First priority is airway and breathing. Apply oxygen as ordered, then address other symptoms. Same knowledge, different approach, and the second approach leads to better decisions. Extra strategies to support your mindset shift, daily mindset reminders. Write on a sticky note, one question at a time. Put it on your desk, your laptop, or your phone background. Simulated NCLEX days. Every week, do one time block of 75 questions. Practice staying in the present moment without jumping ahead mentally. Breathe between questions. A 3-second deep breath resets your focus and prevents rushing. Talk to yourself like a coach. Instead of saying, I'm so bad at this, say, that was a tough one. Let's focus on the next patient. What happens when you make this shift? Students who adopt this mindset report lower stress levels during both study sessions and the actual exam. Improved accuracy because they stop second guessing and start applying frameworks consistently. More confidence in their nursing judgment because they're practicing exactly how they'll think in real life. One NCLEX candidate shared, once I stopped worrying about my overall score and just treated each question like a patient, my practice scores jumped from the 50s to the high 70s in 2 weeks, and I passed the NCLEX on my first try. Final thoughts. The NCLEX is not a test of perfection. It's a test of readiness to practice safely. Shifting from a perfectionist mindset to a one question at a time mindset is the most powerful change you can make if anxiety and overthinking are holding you back. When you approach the exam with the focus of a nurse caring for one patient at a time, you free yourself from unproductive worry. Apply your knowledge more accurately. Build the calm, steady confidence you need to succeed. So before your next practice set or your real exam, pause and tell yourself, this isn't about 75 questions. This is about the patient in front of me. One question, one safe decision, one step closer to pass. Ready to pair this mindset with proven NCLEX strategies? Download your free NCLEX Ultimate Study Guide at nursecareerblueprint.com and prepare with confidence. Please leave your comments below.